Hello and welcome to this lecture. We start with the Helminthes and medical parasitology. Helminthes are metazoa. It's called metazoa because multicellular organisms. So the adult worm, larger, normally visible with the naked eye, in their adult form. They reproduce sexually, usually within the host. So the adult worm, that's meaning mature worm, multiply bisexually. So there is a reproductive male and female reproductive system. So there is that's meaning the adult worm produce ova and sperm and then multiply bisexually, produce second stage which is the ova. So there is ova in Helminthes, and then the ova develop two different larva stages in the Helminthes, which these larvae, some of the species larvae found inside the host, inside human, and the other found outside the host. So there is the adult multiply bisexually, develop and produce ova, and there is the larva. During the life cycle, the larva develop to the adult. They are cause of high morbidity and mortality of people worldwide. Helminthes also cause economic loss as a result of infections of domestic animals. About classification of the Helminthes, divided into two phylum, Nematohelminthes and phylum Platyhelminthes. Nematohelminthes include class nematode or roundworm, include different important species like Ascaris lumbricoides, Angiostoma duodenal, Interrobus, Vermicularis, and so on. Second phylum or Platyhelminthes is called flatworm because the adult is flat in shape. Subdivided into two classes. Class of trematode or the flukes, divided into four groups depending on the habitat. Blood flukes, habitat in the blood vessels like schistosomes. Liver flukes, habitat in the liver or the bile duct like fasciola hepatica. Tissue flukes like Paragonimus wistermani, and intestinal flukes, habitat in the intestine like Fasciolopsis busci. Second class is the class of cystode or tapeworm. Morphology of the adult, it is tape in shape, include different species. The adult found in the intestinal like Tinea saginata and Tinea sorum, or the larva found in the tissue like Echinococcus granulosus. We start with the first phylum Nematohelminthes, include the class of nematode. General characters of nematode include first one, unsegmented. That's meaning the adult consists of one segment. Include several species. Some of them it is small in size, about a few millimeter, and the other like Ascaris are longer. It's about 30 centimeter. Cylinder in shape or cylindrical, covered by non-cellular protective cuticle. The sexes are separated. Male is shorter than the female. Anterior end possess lips. Some of the species, the anterior end contain teeth or hooks, cutting plates, papillae for attachment to the final host. Males have a ventral curve at the posterior end. The digestive system, because consists of one segment, so start with the mouth, esophagus, and there is an important feature of nematodes, muscular structure. that pumps food into the intestine and ends by the anus, which opens on the ventral surface. The nematode divided into intestinal nematodes, the adult found in the human intestine, blood and tissue nematode, the species or nematode found in the connective tissue or in the blood. About the growth or development of nematodes, and the intestinal nematode have only one host. That's meaning the life cycle is simple. Some of the stages found in human and the other in the environmental. While the blood and tissue nematode have two hosts, an intermediate host, and the life cycle is complex life cycle because need two hosts. In nematode, the eggs may be fully mature or immature eggs. What the meaning of fully mature or immature eggs? Because some eggs, when the female produce the ova, some of the ova contain the larva. That's meaning the larva contain inside the ova is called embryonated ova, and the other contain only the zygote. So it is immature eggs. Their life cycle include when the adult of the female produce eggs, the eggs develop to the larva, and in the nematode there are 4 larva stages. So there is larva 1, larva 2, larva 3, and then develop to the adult. So there is adult male and female. After multiplication sexually, the female produce eggs. The egg mature to larva 1, and then the larva 1 develop to larva 2, and then larva 3, 4. After that, the adult male or female. The first and second larva stage, larva 1 and larva 2, is called rhabditiform larva, and the larva 3 and larva 4 is called filariform larva. About the growth or development in the nematode, between each two larva stages, larva 1 for example to larva 2, there is a molt. Between larva 2 to larva 3 there is second molt. Between larva 3 to larva 4, third molt, and last molt between larva 4 and then became the adult. So molt or molting, formation of new cuticle, losing of the old cuticle, rupturing of the old cuticle, and the escape of the larva. So there are 4 molts in the life cycle of the nematode, from the eggs to 4 larva stages and then the adult. This slide shows that larva 1 and larva 2, it is shorter and thicker, and after the molts develop to larva 3 and 4, which are filariform larva, and longer, thinner than rhabditiform larva. That's found in the development of the nematodes. Route of infection or portal of entry in the nematodes. First one, it is orally, which are the most common type of the infection when the infective stage or the infection takes place by ingestion of infective stage or the eggs orally. So the human in this type of the infection ingested the eggs orally with water or food or vegetables contaminated with the eggs. That's common in Ascaris lumbricoides or Trichoris trichura. Second type, the skin. By the ability of the larva to penetrate the skin or mucosa membranes as hookworm. That's found in the hookworms when the infective stage at filariform larva, larva 3. In this type of the infection, the larva penetrate the skin, and from the skin the infective stage found in the blood circulation, and then migrate to the last habitat to develop to the adult. 3. By an intermediate host, that's found in the second group, blood and tissue nematode. In the life cycle, need two hosts between human and second the arthropod or insect or the vector with the bite cause infection. Number 4, auto-infection. In auto-infection, the parasite multiply. For example, in Strongyloid stercoralis, multiply inside the host, inside human, and directly produce the larva stage. Again, the larva cause infection in the same host and cause auto-infection. About the classification or the nematode, divided into two groups. First one, intestinal nematode. In this type, the adult infected of the human infected with the parasite by ingestion of food or water contaminated with ova, which are the infective stage orally, or by the skin penetration. So the adult found in intestinal in this type, like Strongyloid stercoralis, Ascaris lumbricoides, Angiostoma duodenal, Trichinella spiralis, and Enterobius vermicularis, Trichinella Trichuris ticura, or Trichinella spiralis. Second group, blood and tissue nematode. In this group of nematode, the adult found in the deep tissue or in the lymphatic system. The life cycle is complex, need to host human and the insect or the vector, and source of the infection is by the bite in this group. That's about the intestinal nematode. If you look for the life cycle it is simple. Need one host. Some of the stages found inside the intestinal, and then the ova outside in the environmental, and the infection it is orally by the infective stage. In second type, blood and tissue nematode, if you look for the second group, the adult found in the deep lymphatic system, for example in Wuchereria bancrofti, the adult male and female together found in the lymphatic system, in the lymph nodes, and then multiply bisexually, and the infection it is by the bite from mosquitoes from the proboscis. The salivary gland contain the larva stage. So the life cycle it is complex, it is between two hosts, human and the vector. Intestinal nematodes, Ascaris lumbricoides is one of the most common species. The common name is large intestinal round door, because the adult it's about above 30 centimeter, so it's called large intestinal round door. Most common worm found in the human. Geographic distribution worldwide, but more prevalent in the warm, moist soil regions of bad hygiene and underdeveloped countries. Occur in all ages, but it is most prevalent in the 5 to 9 years old. That's meaning common in children. Disease name, roundworm infection or ascariasis. Habitat found in small intestine in human, and the infective stage the egg containing the larva. That's meaning embryonated ova. About the morphology of adult of Ascaris lumbricoides, the male adult measure about 15 to 20 centimeter in length. The posterior end is curved ventrally with two spicules, while the female measure it's about 20 to 35 centimeter, and it is the posterior end it is straight. The anterior end is important in male and female similar. The mouth with three oval lips with sensory palpable. Again, that's anterior end of the adult. Contain 3 lips and male. With the female it is longer than the male, and the posterior end of the male is curved in shape. Okay, the eggs or ova stage, the fertilized female after multiplication between male and female. The fertilized female produce fertilized eggs. Morphology for the egg, this size it's about 75 by 50 micrometers, and the shape it is oval and with 2 covering layer, outer with inner, the outer covered by albuminous layer and the inner thick eggshell. The color is golden brown and contain only 1 cell, which are the zygote. So the fertilized zygote contain the zygote. Female daily produce up to 200,000 eggs. These eggs daily passed with the feces and spread in the environment. So the ova during the stool examination or fertilized ova, it is diagnostic stage, but outside during 2 weeks the fertilized ova or the diagnostic stage develop to embryonated ova contain larva 2, is called infective stage. There are second type of the ova by adult of the female. It's called unfertilized eggs. Unfertilized eggs are produced by unfertilized female. If you look for the size it is larger than the fertilized ova. It is irregular, larger and more elongated, and the size is about 19 micrometer. If you look for the eggshell it is irregular and thin eggshell, contain a thin eggshell. Inside the ova contain granules, so there is no zygote or there is no spherical cell inside the ova. The color it is brown in color. That's about unfertilized ova, because it's produced by unfertilized female. And so there are many differences between fertilized ova with unfertilized ova. If you look for the size, the fertilized ova it is smaller, contain the zygote ovum and thick eggshell, while unfertilized ova it is elongated or larger in size, contain thin eggshell and contain granules, so there is no zygote. Life cycle of Ascaris lumbricoides, infection being followed the ingestion of the infected eggs that contain viable larva 2. So that's meaning the embryonated ova contain larva 2. The ova hatch in the small intestine, where the larva to penetrate the mucosa and submucosa and enter the blood vessels and are carried in the circulation via the liver to the lung. In the lung, the larva migrate and enter the alveoli, and then migration to the bronchioles. And the lungs, when the larva 2, after 2 months, mature and develop to larva 3 and larva 4. The larva 4 stage then move up to respiratory tree, to the pharynx, where it is swallowed. So the larva 4 is resistant to the hostile stomach environmental, and in the small intestine they mature, because the last molt to the adult stage, larva 4 develop to the adult. So last molt found in the small intestine. Adult multiplies sexually, that's meaning multiplication between male and female, and a number of the resulting and embryonated eggs up to 200,000 of the ova produced daily by female are passed in the feces, and soil provides the necessary conditions for the eggs to embryonated infected eggs remain viable for a long time. The life cycle of Ascaris lumbricoides, if you look for the infective stage, we start with the infective stage, it is embryonated ova. The embryonated ova can contaminate the vegetables, water, or food. The embryonated ova, that's meaning the ova contain the larva or larva too. With the water or vegetables migrate to the small intestine. In the small intestine, the larva to hatch from the ova and penetrate the wall of the small intestine, and then with the blood circulation migrate to the heart and then in the lung. In the lung phase, which are the important phase, larva 2 after 2 molts. After molt 2 and molt number 3 develop to larva 3. After that, the larva 4, and that's mean after molt 3, larva 4 migrate and return to the small intestine, and then after last molt in the small intestine, the larva 4 develop to the mature adult, male or female. After that, the female and male multiply sexually, produce fertilized ova. That's meaning contain zygote, and fertilized ova with the feces pass to the out and spread in the environmental. And during 2 weeks, the fertilized ova develop to embryonated ova, which are the infective stage. Pathology and clinical features. Number of the adult, it is important in human. It can be asymptomatic. The patient infected with a small number of worms. For example, 5 to 10 adult will often remain asymptomatic. So number of the adult, it is important for the pathogenesis. But in the large number, if the host or human infected with a large number of the ova develop to a large number of the adult. So we have intestinal stage. Intestinal stage cause obstruction of the intestinal, and then pancreatic duct or appendix, especially in children. So can cause obstruction for intestinal, pancreas, and appendix. Hepatobiliary ascariasis, one of the important common pathogenesis, when includes biliary colic, pancreatitis, infection due to obstruction of the common bile duct, and hepatic abscess. Penetrate the intestinal wall, migrate to the stomach, and may be vomited, because a large number of the adult can migrate to the stomach, or some of them can migrate out of the anus or common out the mouth or nose by migration of the adult. That's about the adult. About the migration larva stage during the life cycle, as I mentioned before, when the larva to migrate to the lung. In this stage, cause pulmonary migration of the larva may result pneumonia lasting up to 2 weeks, developing about 2 weeks after ingestion. Larva found in the terminal air spaces and bronchioles, and then pulmonary migration is associated with fever, dyspnea, and asthma. Again, in this stage, number of the larva, it is important, and then develop to the cough, expectoration of blood stained sputum, and develop to Lafleur syndrome, the respiratory phase of ascariasis, marked by inflammation of the lung and eosinophilia. Finally, occasionally some larvae reach the left heart and are distributed to various organs as lymph nodes, brain, spleen, kidney, and other organs. Again, that's depend on the number of the larva. Okay, this slide is appendix. If you look, that's appendix contain the adult of the Ascaris. That's meaning the Ascaris migrate to the appendix and found inside the appendix. So Ascaris in appendix which cause symptoms suggesting appendicitis, or migration out of the mouth or nose by the adult. Diagnosis, detection of the eggs in the stool during the stool examination, finding the adult in the stool or vomited. So stool examination is one of the important tests for the eggs and for the adult. Detection of the larva and the sputum during the sputum examination. Eosinophilia, when increased number of the EO. Larval syndrome is present in the larva invasion stage. Other tests like serological diagnosis, antibody detection by indirect hemagglutination or IFAT test, or by imaging methods, X-ray, CT scan or ultrasound to determine the adult or the larva stage. About treatment, drugs of choice, different drugs, mebendazole, parental pamut, piperazine straight. That's for the adult or for the larva stage in the lung. In intestinal tract obstruction, when a large number of the adult found in the intestinal develop to obstruction, surgery may be required for the adult. And thank you for your listening.